The name Lassa fever rings a bell of caution, prevention and vigilance. This is due to its nature of reoccurrence yearly, a viral hemorrhagic fever that is primarily transmitted to humans via contact with food or household items, contaminated with urine or feces from Mastomys rats. Report by the Nigerian Center for Disease Control and Prevention highlights that the country has confirmed 535 cases of Lassa fever across 14 states this year. Now, the Nigerian Center for Disease Control and Prevention National Lassa Fever Technical Working Group is at the core of leading efforts to prevent, detect and respond to cases of Lassa fever across the country through enhanced surveillance of activities ongoing across states. A burden that puts the nation's health system on a stretch. Unfortunately, annual outbreaks of Lassa fever has also involved the infection and death of health workers. Well, quite sad. But what is the capacity of the nation's healthcare systems to tame Lassa fever cases? Are there adequate treatment centers and medical supplies? Well, on Weekend File tonight, we will be looking at ways of taming the spread of Lassa fever in the country. And our guest is Dr. Yetunde Abioye, Incident Manager, National Lassa Fever Emergency Operations Center from the Nigerian Center for Disease Control and Prevention. We'll bring you situation reports from across the country. Thank you for joining us. This is Weekend File. I'm Ruth Aguele. First, let's begin with the news. Minister of Health and Social Welfare, Professor Ali Pate, says the federal government has taken steps to address funding gaps in the nation's healthcare system following recent withdrawal of donor support by the United States. He stated this at the interactive session with the House Committee on HIV and AIDS, Tuberculosis and Malaria. National Assembly correspondent Mitaire Ikben reports.
A cloud of uncertainty over funding of public health programs led the House Committee on HIV, AIDS, Tuberculosis and Malaria Control to invite the Minister of Health for clarification. The minister informed lawmakers that some initiatives by the Tinubu administration in the health sector helped in mitigating the effect of the sudden withdrawal of donor support by the United States.
We are conscious that there may be priority items in the short term which would need to be procured as a matter of emergency to ensure there is no gap, and that there is medium term over the next 1 to 2 years what we need to provide in the context of 2025 and 2026 and 2027. And then the longer term, what needs to happen in terms of the structure of our medical industry so that we can be able to buy all those items here in Nigeria. All levels of government have to pull their weights so that we achieve.
I have called for malaria treatment to be made free at primary health centers in Nigeria to ease the burden of malaria in our country, and for the subsidization of basic malaria drugs and consumables. We must work together to ensure we get this right and rid our country from all public health threats by 2030.
The lawmakers stressed the need for regular interface with the minister to ascertain progress in bridging funding gaps in the nation's health sector. From the National Assembly, Mitaire Ikben, NTA News.
The House of Representatives is making moves to ensure that ministries, departments and agencies of government establish climate change desk as provided in the Climate Act. This was during an investigative hearing on the implementation and challenges of the 2024 budget between House Committee on Climate Change and Security and some ministries. National Assembly correspondent Mohammed Rabiu Ali reports that the meeting at the instance of House Committee on Climate Change and Security reviewed the 2024 performance of ministries aimed at addressing the challenges of climate change and security issues.
I must re-emphasize that we have to take this Climate Change Act very, very seriously in this country. There are a lot of money to be, gotten from the international community. And until we'll be seen to be taking this matter very seriously, I don't think we'll probably have access to such funds. The Act specifically said that every agency, ministry, parastatal, MDAs will have a climate change desk. This committee cuts across every agency, every committee in this country.
The committee expressed displeasure over the absence of some key players invited to the hearing. In other news, in an ongoing inspection of Nigerian roads under construction by the Federal Ministry of Works, the Minister of State for Works, Bello Mohammed Goronyo, has inspected sections 1 and 2 of the Sokoto-Gusau Road Dualization project with the optimism that the completion period is achievable. Bashir Ibrahim Nababa will tell us more.
The inspection of the project sites by the Minister for State Works, Bello Mohammed Goronyo, is in line with the marching order by President Bola Tinubu for the ministry to embark on infrastructure assessment tour to ensure compliance to contractual agreements and timely delivery of quality work by contractors handling various federal government roads for the benefits of Nigerians. The Sokoto-Gusau dual carriage highway is part of the renewed hope agenda of President Bola Tinubu on critical infrastructure to enhance security, fast-track economic growth, and improve connectivity in the Northwest region. The ministerial train had a stopover at one of the project sites for an interface with the contracting firm to ascertain the level of progress. Bello Goronyo insists on execution of nothing other than quality work that will endure for many years, which is what the President Bola Tinubu infrastructural transformation is all about. He noted that potholes repairs are carried out simultaneously with the ongoing construction of the new concrete road to ease vehicular movement. Goronyo maintains that the completion period for the project is realistic with collective efforts of all stakeholders. The Federal Ministry of Works, FEMA, and other stakeholders will collaborate to come up with measures to ensure that these roads are safeguarded for maximum use.
There is a lot of advantage in building and maintaining a good motorable road. So we call on all the stakeholders to support Mr. President to ensure that our roads are adequately maintained so that we can reap the benefits of those infrastructure, which Mr. President has placed a very serious priority on it.
The ministerial train continues with its project delivery inspection tour to other parts of the country. From Sokoto.
Ibrahim Nababa there. The 43rd, ECOWAS Chiefs of Defence Staff meeting ends in Abuja with a strong commitment to combat terrorism and other trans-border crimes. Chairman of the committee and Nigeria's Chief of Defence Staff, General Christopher Musa, says the platform provides avenue to critically examine resolutions of the last meeting and prescribe measures to combat emerging regional security threats.
I am delighted to note that this meeting has been most rewarding. Deliberations have been sincere and forthright, with our collective security being accorded the desired priority. Our gathering over the past 3 days has been geared at promoting regional security, cooperation within the ECOWAS community, and forging common front in addressing our security challenges.
Similarly, the Minister of State for Defence, Bello Mohammed, enjoins ECOWAS Chiefs of Defence Staff to strengthen military collaboration, intelligence sharing, and capacity building to safeguard the region and its people. He was speaking during an event organized by the Defence Headquarters for the 43rd Ordinary ECOWAS Committee of Chiefs of Defence Staff in Abuja.
Chief of Defence Staff, reaffirm our dedication to strengthening military collaboration, intelligence sharing, and the capacity building to safeguard our nation and people.
We know the challenges we're facing and how important it is for us to cooperate and collaborate together, as no nation, no single nation or single entity can confront the challenges we're having. We need to work together as brothers and sisters.
The Chief of Defence Staff says the prevailing security challenges facing the sub-region requires collaborative efforts of all the affected countries to build a safer and prosperous West Africa. Sheyi Tinubu, son of Nigeria's President Bola Tinubu, has visited Yobe State as part of his ongoing youth engagement drive and Ramadan Iftar outreach. Accompanied to the state by the Minister of Youth Development, the visit aims to inspire young stakeholders to become active contributors to the country's growth and development. Yunusa Suleiman reports.
Sheyi Tinubu, who is visiting Yobe State for the first time, met with Governor Mai Mala Buni as a gesture of respect and to formally announce his presence in the state. This visit is part of Sheyi's ongoing Ramadan outreach program and youth engagement, which has already taken him to several northern states including Kano, Sokoto and Kaduna. In addition to his meeting with Governor Buni, Sheyi also paid a visit to the palace of Emir of Damaturu, where he was received by the monarch, Alhaji Shehu Hashimi II Ibn Alamin El-Kanemi, and sought the royal blessing for his mission to the state. At the Iftar venue, the visitor interacted with hundreds of Yobe youth from diverse backgrounds to inspire them, as well as drive the renewed Hope Youth Engagement agenda.
We know that the president has you in mind. The president knows your plights and everything. And every possible best, we have great initiatives that are for the young people. And we are going to make sure that it gets to Yobe.
As the holy month of Ramadan continues, Sheyi Tinubu's outreach program is expected to cover more ground, promoting unity in Damaturu. Yunusa Suleiman, NTA.
President Bola Ahmed Tinubu congratulates Professor Gabriel Osude, an academic, pharmacist and public health icon, as he celebrates his 90th birthday. A statement by his special advisor on information and strategy, Bayo Onanuga, commends the distinguished scholar and institution builder for contributions to pharmaceutical education, drug regulation and public health in Nigeria, with his pioneering work in establishing the National Agency for Food and Drug Administration and Control, NAFDAC, for his role in developing the pharmacy education curriculum at Ahmadu Bello University and the University of Benin. Commending Professor Osude's long life dedication to strengthen Nigeria's drug regulatory framework, President Tinubu wishes him good health and continued wisdom as he inspires the next generation of health professionals. Vice President Kashim Shettima has reaffirmed the federal government's commitment to ensuring lasting peace, stability and economic development in Plateau State and across Nigeria. The Vice President, who was in Jos to commiserate with National Chairman Council of Ulama, Jama'atul Izalatul Bidda, Waikamatis Sunnah, Sheikh Sani Yahaya Jingir, over the death of his close associate, Sheikh Saidu Hassan Jingir, commended Plateau State government peace-building efforts while offering prayers for the repose of the soul of the late Sheikh Saidu Hassan Jingir. Vice President Kashim Shettima also prayed for peace, stability, cohesion and progress across the nation. Sheikh Sani Yahaya Jingir expressed gratitude to President Tinubu and Vice President Kashim Shettima for their show of compassion during this difficult period. The religious leader praised the government's responsiveness to infrastructural needs, economic policies and security situation, especially in Plateau State. We'll take a break now. When we come back, we'll begin our conversation on how the federal government is stemming the spread of Lassa fever. Do stay tuned. Thank you for staying tuned. Lassa fever, a deadly viral hemorrhagic illness, is caused by the Lassa virus and a direct contact with infected rodents or their bodily fluids. Well, it's the primary mode of transmission. Nigeria continues to record increasing Lassa fever cases and fatalities, which the country ramps up efforts to tackle the outbreak. This report examines the impact of Lassa fever on Nigeria's health system, vaccine prospects for the nation, and other African countries in efforts to save the situation.
Case fatalities linked to Lassa fever are increasing in Nigeria as the nation's Center for Disease Control, in its epidemiological report recently released, confirmed 3 new deaths, increasing cases recorded in 2025 to 98. In the week 9 reports, the country have now recorded 2,728 suspected cases, 535 confirmed across 14 states, putting case fatality rates at 18.3%.
There has been an alarming increase in Lassa fever cases and deaths, signaling the outbreak severity. First, the case fatality rate has consistently remained high. We have heightened our surveillance activities and preparing for this outbreak season. Critical medical supplies, infection prevention and control materials have been distributed to the various states nationwide. The technical working group has categorized this risk as high and put at response level 2 and advised that efforts be tailored specifically to the states currently experiencing increased case burden.
Lassa fever often starts with common flu-like symptoms, making early diagnosis critical, and its other key symptoms include high fever, severe headache, and body weakness, cough and chest pain, sore throats, as well as uncontrolled bleeding in severe cases. Nigeria has since been strengthening national resilience and preparedness. Early in the year, the country activated a new Lassa coalition and governing entity with a target of developing national prevention strategies to combat Lassa fever, a disease of regional and global concern.
Our mission here is to ensure that we deliver, together with our global partners and CEPI and all others, an accessible, effective, safe vaccine through a robust regional and country-owned processes and leadership, while fostering the partnerships that will ensure that we mitigate the impact of this disease over time.
Though national emergency response to these disease outbreaks has often been widely praised due to swift action, public health coordination, international support, and building on lessons learned, but still, gaps exist in healthcare infrastructure like inadequate testing, insufficient protective equipment for healthcare workers, and challenges in contact tracing. In Abuja, Olusheye Adiagbo, NTA News.
And casualties arising from the spread of Lassa fever in Taraba State have risen from 10 recorded deaths to 49, with 98 confirmed cases and many under investigation. As a result of this, the state government, we hear, has procured medications to tackle further spread of the virus, while calling for the intervention of the federal government and donor partners to end this menace. Well, let's hear from Madeline Matthew.
Taraba State recorded 181 cases of the virus since the outbreak of the disease in January 2025, with 10 deaths and 76 confirmed cases.
Across the state, total, we have 238 suspected cases, from which sample have been taken from. Out of this, we have 98 positive cases, and then we have 141 negative cases. Total till date, we have a total of 49 deaths so far.
In an effort to control the spread of the virus, Taraba State government is engaging stakeholders across the affected local government and providing logistic support to curtail further spread of the virus.
And we're able to procure drugs and consumables, which we distributed to all the treatment centers. And it is with that that people are able to be helped.
Residents acknowledge the dangers associated with the deadly disease and advise everyone exposing their food items to ensure their protection against rodents, which have been identified as the major carriers of the virus.
The rats are the major carriers of Lassa fever. It's just to prevent your food, even in the house, because we don't know if they are the rats in the house or the rats outside, the one in the bush. We don't know which of them that carries the Lassa fever.
The food that was sprayed on the road, and if an infected Lassa fever rat move on it, when you eat, it will be infected. And this time around is very common. When you go to Taraba, said most of the on the road, you see people are spreading food stuff on the road.
They urge the federal government and other partners to intervene to reduce further spread of the virus. In Jalingo, Maudlin Matthew Bello, NTA News.
All right, let's bring in our guests. We have in the studio Dr. Yetunde Abioye. She's the Incident Manager, National Lassa Fever Emergency Operations Center from the Nigeria Center for Disease Control and Prevention. Thank you so much for joining us, Dr. Abioye.
Thank you for having me.
All right, we've seen the situation in Taraba and across the country, quite alarming. But you tell us you're dealing with this directly, you're involved directly, well, so to say. So what exactly are we dealing with? And what are the current statistics at the moment?
All right, thank you so much once again for having me. For Lassa fever, we know the trend, right? We have cases recorded all year round. But then, especially when it comes to the dry seasons, that's beginning from October, we begin to see a rise in cases. These are trends we've seen based on data that has been gathered over the years. And based on this, we're already preparing. Earlier, before even the outbreak season started, we did an after-action review that's like to check what we did in the last outbreak in 2023/2024 outbreak season to see how to increase and better prepare ourselves. So we kept on monitoring. We were on watch mode after we had de-escalated our activities in the Emergency Operations Center in June. And then we did a dynamic risk assessment just to assess, the risks we are currently in the country. And this was done on the 16th of December 2024. The output of that risk assessment placed the country at a very high risk, looking at the festive seasons as well coming up. And we know that, especially nationally, we have that peak period beginning in December with the festivities and all of that. And we activated immediately the incident management system, which is what we use at the Emergency Operations Center to be able to control the outbreak across different pillars of coordination: surveillance, risk communication and community engagement, case management, and psychosocial support, infection prevention and control, environment, safe burial practices as well. Food safety not left out. So even, colleagues from the Federal Ministry of Agriculture are also quite embedded in this response for the outbreak. So following that, we developed a plan to be able to guide our response efforts for the country. And we also deployed a National Rapid Response Team to 10 states out of the number of states we have so far that are currently undergoing the outbreak. So far, we've had almost 3,000 suspected cases and almost 600 confirmed cases as well. We have over 560 confirmed cases. Unfortunately, we have lost over 100 of these confirmed cases. And this has left our case fatality rate to just be under 20%, which is at 17.8% at the moment. But then also the trend we've seen over the years is that we've only been able to keep this case fatality rate, which is amongst the confirmed case. Now, the number of people that have died, right, amongst the confirmed cases to just under 20%. And for us, we've continuously tried to increase our surveillance system, right? We've also continuously increased our laboratory network. We've also, with the support of our partners and collaborative efforts across the state, procured, medical countermeasures like PPEs, giving riverine to all the, through the State Ministry of Health, to be able to also help in controlling the outbreak.
Okay, so going by the efforts so far by the agency, to ensure coordination and surveillance, let's look at case management. It's quite unfortunate. We saw Taraba from 10 recorded deaths. We're counting 49 so far. It's really unfortunate. So in the aspect of case management and providing them, you talked about laboratories, testing, making it available to ensure that states are able to manage these cases and curtail the spread.
Yes. So what we do the NCDC helps with coordination of, the prevention and control of Lassa fever. But what we do is a collaborative effort with the states. So NCDC, with the support of partners, is able to procure ribavirin, which is the drug that we use to manage cases of Lassa fever, because what we usually do is actually supportive therapy, right? So ribavirin is one of these drugs that we use to manage these cases, and we have treatment centers across all the geopolitical zones of the country, with even some states even having more than one treatment centers, and then holding areas where these cases are treated. So in collaboration with the State Ministry of Health, this drug is being distributed across the primary, secondary, and tertiary healthcare facilities in the states, and also the states also have some partners at that level who also help to support them with some PPEs and also support with ad hoc staff, especially during the peak seasons of the outbreak season. Because one thing is, in Nigeria, there is no time where we don't have cases of Lassa fever. Even during the rainy season, we are still at risk of Lassa fever, but more at risk, especially during the dry season. So we use this collaborative effort. We also have trainings. Currently, we also have our case management guideline, which was done in 2018, but then this is also prioritized to be updated because we know a lot of data and things have changed over time. We also have trainings that we do from time to time. We did the pilot of the first Lassa fever case management fellowship in 2023, August to September, and we also have a fellow who is in Federal Medical Center, Jalingo. Like I'm just using an example of Taraba. We had 12 fellows across the country, and luckily for us, these fellows are still very much in the country as well, supporting control and management efforts. We also have planned trainings that we plan to do. Unfortunately, the USAID funding also affected that, but that was also supposed to be supported by WHO. But we're trying to explore alternative ways to see how we can also support this training in Taraba and Plateau State, which is what we have planned so far. We've done that in Benue, we've done in Ondo, and we've also done in Ebonyi State. So we have quite a lot of multi-pronged approaches to ensure that, we continue to see how we can support our case managers, because as much as possible, we are also very much aware of the healthcare workers' attrition, and the healthcare workers that are still available in the country, supporting and managing this very deadly disease. We are also committed to ensuring that they are properly trained and have the right resources to protect themselves at all times, in collaboration with the states or where they work as well.
It's even unfortunate that the health workers are also affected, because we've heard of cases where they've been infected, by the virus. Let's take a break, Dr. Abioye. We'll be back to pick up with the conversation. Thank you for staying tuned. Well, as Lassa fever continues to affect more states and claim more lives in the country, experts say enlightenment campaigns will help in overcoming the spread, as lack of awareness is a contributory factor to the rising cases. John Adams will tell us more.
Lassa fever outbreaks are most prevalent in West Africa during the dry season. Lagos State, characterized by a huge volume of business activities, thereby attracting people from both within and outside Africa through the land borders, seaports, and airports, serves as potential entry and exit point for the disease.
The ports of entry, port health has been beefed up this recent month than before. There's better vigilance there. People are now enlisted as they come in and ready to be followed up in case there's any incidents.
While treatment centers and medical supplies are available, inadequate infection prevention and control measures still remain challenges that need to be addressed.
As a government, we need to be more prevention-oriented. That's where we need to be. Prevention. What are the things we need to do? We need to put the right equipment in the hospitals. We need to find a way to retain the medical personnel in Nigeria.
Medical experts are advocating community enlightenment as a way of preventing the spread of Lassa fever. In Lagos, John Adams, NTA News.
All right, Dr. Abuye, you've seen what's happening in Lagos, especially in the aspect of creating awareness, which brings me to the aspect of building capacity for the country. How far has the agency gone, you know, in sensitizing rural communities and also the populace, educating them on what to do and what not to do?
All right, thank you so much for that question. So we've actually engaged through our various networks like the Nigerian Red Cross and many other partners across the state, and in collaboration with the State Ministry of Health, the State EPIDs, the Directors of Public Health, to see how we could be able to increase awareness for Lassa fever. It's very important to note that Lassa fever is not a death sentence, and there is also need to destigmatize Lassa fever. The earlier people are aware of what to do. For instance, we always say once you have treated malaria or any type of fever, maybe from a bacterial infection, for 2 days, which is 48 hours, and is not responding, you should really present yourself immediately to the hospital, and also you should raise a high index of suspicion to the healthcare workers for Lassa fever. So it's very important. We know that outbreaks occur and ends in communities. Once communities are involved and able to also carry out community-led interventions, this will greatly help reduce and prevent Lassa fever spread within the communities. So this is one of the key strategies that we've also seen to have worked. When we also deployed National Rapid Response Team to states who were reporting at that time, to 10 states, which we did in this particular outbreak, part of the things they had for their terms of reference was also to engage the communities, of course, engage the various actors in the continuum of care for Lassa fever, of course, even carry out sensitization in mosques, churches, to be able to get the community in a state, you know, whereby they are enlightened to take informed decisions. These are part of the things we've done. And even there was a time as well, we also launched a course. Well, it's still very much available for healthcare workers to be able to do, you know, be able to increase their index of suspicion for Lassa fever. It's a very mobile-friendly course which can be taken at the comforts and at their own pace. And we did this in collaboration with the MPA, CDA, and Resolve to Save Life, and Affinet as well. We've also carried out some form of sustainability plans, especially leveraging on the network of Nigerian Red Cross across 36 states and FCT. And even last year, or the last outbreak season, we also implemented a project, the DREF project, the Disaster Relief Emergency Fund project with the Nigerian Red Cross. And this was done in certain high-burden states in the country. But we know that more effort is needed, especially to be able to reach more people across 30 states and FCT. I mean, even in high-burden areas, you still have issues whereby people are misinformed or disinformed about Lassa fever. Some people think, you know, it's an anger of the gods or it's just a spiritual attack. But actually, I mean, these rats carrying the virus, mastomys rats especially, of course, you know, live within homes based on the poor natures of the buildings, or people that may be farmers who are in the farms, living in shacks with their farms, you know, easily come in contact with this rat. And unfortunately, sometimes you see this, these farmers coming down with this disease, and sometimes, unfortunately, resulting in fatality. So risk communication and community engagement is very much important. It's also important to know that Lassa fever is not a death sentence. We need to destigmatize it, and early reporting and presentation at a healthcare facility saves lives.
All right. You keep saying it's not a death sentence, but we hear numbers of people who have died from it. But again, I'm sure that's part of the challenges you're contending with the agency, in the aspect of people not coming out to report cases, especially when they notice these symptoms. Would you confirm that?
So unfortunately, yes, we know that, especially engaging with the community, we've had issues whereby people are not, well, in a way, sometimes maybe the stigmatization and then poor awareness, especially when it comes to hard-to-reach areas as well. Before people report to the healthcare facilities, you notice that perhaps they've been nursing this infection for maybe an average of 7 days, right? So we always encourage, especially like I said, once people have treated, of course this will be done with a lot of, community engagement, mobilization, plays and dramas and jingles and all of that, and also using, the key gatekeepers, whether it's in religious settings where you have pastors or imams, or people, political elites as well, letting people know, religious leaders, right? Letting them also know that this disease is preventable. It is our collective responsibility.
When you say preventable, you haven't, sorry to interject, you haven't given us briefly now what to do and what not to do.
Okay, so usually the rats, mastomys rats, right, which are very common in our environment, transmit this virus. And they don't show any sign of infection, like you wouldn't just see a dead rat except it's been poisoned or died of natural causes. So it's very important that people cover their foods properly, right? Keep their environment clean, ensure that they don't also eat food that has been contaminated with the feces or urine of rats, right? It's also important that you also, our houses, we kind of cover holes where these rats can easily have access to ensure that we build according to the standard. And we also set traps for these rats. And it's also very important that people avoid, drying foodstuffs on the road, right? Because, there will be different types of contacts with rats. Storage is also very important, whether at the level of the household or even for people, vendors, market vendors who are also selling this produce. It's very important that they also, in their stores where they store these food produces, that they actually, put it in appropriate containers like drums where rats will not have access to it, and where these rats have also contaminated this foodstuff, we advise that people do not consume such food.
I wanted to ask you if it's okay to eat it. We see people eat rats.
Yes. So, I mean, it's actually a choice, a message of caution, right? Yeah. Because even though we know, like, even the chicken that we eat and even the goat meat or sheep, they have also diseases that they transmit to humans. But what we advise is for people to apply caution, especially in this high transmission season. We understand in some cultures, this is actually a delicacy, but this particular time especially is a high transmission season for Lassa fever, and we dissuade people to, to avoid, especially at this point in time, eating rats. Okay. We know it might be a, like for some, it's just like saying do not eat eggs because you could get, maybe you could get salmonella or all those kind of diseases. But especially now that we know that this is a season for Lassa fever transmission and contacts with these rats, especially in homes or even consuming them, whether hunting or preparing it, can really, really expose you and your family. So please stay safe for you and your loved ones.
Thank you very much, Dr. Yetunde Abioye, for your insight on Weekend File. Thank you so much for educating Nigerians on the need to tame this Lassa fever. All right, let's go on a break. We'll be back. Thank you for staying with us. The present administration's commitment to projects that will uplift the socio-economic life of Nigerians will not be deterred with comments or critics who label these projects as wasteful. Minister of Works David Umahi reacted to criticisms made on the Lagos-Calabar Coastal Highway while inspecting the first section of the road. Larry Belay reports.
The goal to unveil the first section of the Lagos-Calabar Highway by May this year is becoming a reality, as the fast pace of work on the concretized section surpasses time projections. This, the minister describes as a confidence booster. He used the opportunity to set the record straight on remarks made by some Nigerians.
Why single out this one, to say that it's wasteful? Is it wasteful because it is connecting to all the, existing roads that, we make life very easy, that from the existing road you just come to this, and from here to Calabar, you'll just be there in 5 hours. So travel time will be achieved and it will be less. It's an evacuation corridor. Presently, in the next, 6 months, we'll be able to have this section 1 completed. And so the problems we are having in transloading, ship that the draft are so deep, will now be betting at the Lekki deep sea port.
The minister, however, welcomed all criticisms on the administration's road projects, saying he's got answers that prove beyond doubt that they are done within the ambit of the law, under careful considerations of its socio-economic importance and the years of legacy it portends for national development. In Lagos, Lanre Bileyi, NTA News.
All right, next will be sports update, and Ayo Deji Makinde is already set to guide us. Hello, Ayo.
Thanks, Ruth, for joining us. Handball Federation of Nigeria is building the capacity of handballers in the country with trends and tactics in line with International Handball Federation standards. To this end, over 20 coaches, mostly retired international and national players, are participating in the IHF C license course in Abuja. IHF representative Zoltan Nashinska, who is training them for their badges, maintains that their certification will afford more opportunities to compete with the best in the world.
Build upon the experience of the players here, and I would like to extend their knowledge in terms of theory and practice to be a better coach and to be a better educator for the future.
If the coaches are not developed technically, tactically, psychologically, mentally, it will actually affect the performance of the team.
With this kind of a course, we believe that it's going to at least update the knowledge of our coaches. And the moment the knowledge of the coaches are updated, definitely it's going to be transferred.
Right, Nigeria is through to the final qualification round for the FIFA Under-17 Women's World Cup after they beat South Africa 2-0 in Ikene-Remo, Ogun State for a 5-1 aggregate scoreline. Goals from Harmony Chidi and Aishat Animation sealed easy passage for the Flamingos, who had earlier beat Botswana 3-1 in the first leg a week ago in Pretoria, South Africa. Next stop for Nigeria is the winner of the match between Algeria and Botswana at Stade Mustafa Chaka in Blida. Let's quickly move on to the English Premier League, where the London derby between Arsenal and Chelsea at the Emirates on Sunday afternoon headlined the pack this weekend in the league, as matches for week 29 were concluded before the international break. Meanwhile, in today's pairings, Jacob Bryan scored in the first minute of stoppage time for Everton as they drew 1-1 with West Ham United at Goodison Park. Nigeria's Paul Onuachu scored in the 76th minute for Southampton, but that was not enough for the Saints to avoid going down by 1-2 to Wolverhampton Wanderers at St. Mary's. Nottingham Forest continued their push for European football next season with a 4-2 victory over Ipswich, just as Brighton forced defending champions Manchester City to a 2-2 scoreline. That's your sports. It's back to Ruth.
Thank you, Ayo. And just before we go, let's check out tomorrow's weather prospect.
A significant shift in weather patterns is underway as the ITD continues its southward retreat. Meanwhile, a dust plume over Chad Republic is expected to bring slight dust haze to Borno, Yobe, Jigawa, Kano, and Katsina. We're expecting a mix of patches of cloud and sunshine intervals across the remaining parts of the north, extending down to the southern regions. Parts of Akwa Ibom and Cross River can expect morning thunderstorms. As we head into the afternoon, isolated thunderstorms are expected over the coastal cities and most parts of the inland cities of the south, reaching as far as southern Kwara, Kogi, and southern Benue. That's where we conclude our weather forecast. I'm Safia Senginusa. Thank you for watching.
And there you have it. That concludes Weekend File. Thank you for your company. I'm Ruth Aguele. Good night.